Okay. Thanks for the introductions in the chat. Keep those coming. We love reading through them to get a sense of who's joined us today. So keep them coming if you'd like. So I will go ahead and start us off and again welcome you to this webinar on leveraging local and regional resources in partnership to address workforce shortages. Before we get started, I just want to take a moment to ensure that everyone in the audience is ready and comfortable with the technical aspects of the webinar before we get started. As you might see, we have closed captioning enabled for today's webinar, and we also have American Sign Language capabilities enabled as well. You can activate the ASL by clicking the interpretation icon on your Zoom navigation bar. If for some reason that's not working for you, or if you need tech support for any reason during this webinar today, please send a chat message to the hosts and we'll address those for you and help you troubleshoot. Also, if you have questions during the presentation, please feel free to use the Q&A area in your bar as well. Those questions are going to come directly to the presenters and moderators. And of course, we'll have plenty of time and dedicated time during spaces during this webinar to answer questions. So if as you're taking in this information, a question sparks and you really want to get it down, the best way to do that is to get that Q&A and we'll make sure that your questions are answered. Okay, let's get started and go to the next slide. Before we get started with our content, I would just like to note that the views expressed by speakers and moderators here today do not necessarily reflect the official policies of the U.S. Department of Health and Human Services and the Substance Abuse Mental Health Services Administration, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Next slide. My name is Lydia Hernay. I am so happy to welcome you to our webinar today. I'm a behavioral health project manager at Altarum, and today's webinar is hosted by SAMHSA's 988 Crisis Systems Response Training and Technical Assistance Center. So SAMHSA has selected Altarum to provide this assistance to support states, territories, tribal organizations, and community partners across the 988 Suicide Crisis Lifeline and Crisis Continuum of Care. We do that with our partners, W2 Consulting Corporation and Change Matrix. And we're really pleased to welcome you today as part of the TTAC. We'd also like to thank Purple Communications for providing American Sign Language interpreters for this presentation. Oh, thank you. One thing that I'd like to do right now is thank our SAMHSA partners. First, I'd like to thank Jill Mays, the Division Director of Crisis Systems Transformation for the 988 and Behavioral Health Crisis Coordinating Office at SAMHSA. Jill is the leader of the TTAC and just our champion, and we just really appreciate her support and everything she does for the TTAC and for the field so that we can bring you offerings like this on a regular basis. And next. And I'd also like to thank Captain Corey Palmer, who is the commissioned officer in the U.S. Public Health Service with over 20 years of experience improving health outcomes and increasing access to quality health care. Captain Palmer is with us today. I am really excited to hand this over to him. He's going to help facilitate and moderate our webinar today with our speakers. So Corey, I will pass the mic over to you.
Thank you so much, Lydia, and welcome everyone. Good afternoon, to everyone. Maybe some in the mornings or good morning to everyone. So welcome everyone to our session. I will be just a facilitator of this webinar. Next slide, please. This webinar, I will introduce the agenda, introduce the speakers for this webinar. We're planning to have, there are 4 speakers that we have prepared for this webinar. We will have each of them, I will do the introduction first, and then we will have each of them do their presentation. And after each presentation, we will have a brief time to do some Q&A there for a few minutes, but we also have at the end of all of the presentation, we will have additional time for question and answers as well before we do a wrap up. And so that's kind of the general flow of the webinar for today. Next slide, please. So I will start with the first presenter that we have here. I'm excited with this panel of presenters that we have today. First presenter will be Connie Sharp. She's coming to us she's the director of membership for the National Association of Workforce Board. She has over 24 years of experience in workforce and talent development for programs. In her current role, she designs and implements innovative membership strategies and partnerships that deliver value for her members. She's in her previous role, she has been served as a local workforce board program operator manager. She also, in another role, she worked as a student servicer for Oklahoma State University and the University of Oklahoma Health Service Center. She's also certified as a Lightcast user and certified as a workforce development professional. She's earned her bachelor's degree from Oklahoma State University and her Associate of Art degree from Rogers State University. Next slide, please. Our next speaker comes to us is Tamara Barbary. She's a seasoned senior public health analyst from the Health Resources and Service Administration from the Bureau of Health Workforce. She's the lead for the Area Health Education Center program. She used most of her time as serving as the lead for this program on cooperative agreement. She also has expertise in strategic initiatives that she worked with her branch in the Health Careers Pipeline branch in advancing cross-cutting health workforce program. In her previous role, she worked as a community health educator, where she had over 20 years of experience in community health education and public health. She also served in the United States Army as a logistic data analyst. In her previous role before that, she served as a public health investigator for the Baltimore County Health Department, where she investigated health disparities and developed educational programs and partnered with the community organization. She has a master's degree in public health from the University of East Tennessee and a Bachelor of Science in Health Science from the University of Hawaii. Next slide, please. Our next speaker is Isabel Gorgoroso. She is a team lead for the behavioral health programs in the Bureau of Health Workforce and the Health Resources Service Administration. She manages her portfolio for professional training programs, which are aimed to equip providers and expand service in rural and medically under-resourced communities. She's a Commissioned Corps Officer for the Public Health Service. She has been on numerous deployments across the country for clinical care and training through the public health emergencies. And she served as a nurse and public health educator. She has her Bachelor's of Science in Nursing from the University of Rochester and a Master of Public Health from the University of Massachusetts. Next slide, please. Our last and final, certainly not least, speaker is Carrie Dorn. She's a licensed social worker with more than 15 years of experience with behavioral health practices and policies. She's worked both on the local and the national level. She currently serves as the team lead and the senior advisor for the public health program within the Bureau of Health Workforce and Health Resources and Service Administration. She manages her portfolio of grants that support paraprofessionals and professional training programs. Prior to HRSA, she worked with the National Association of Social Workers, where she focused on health practices, trends, and policy issues affecting social workers and communities that they serve. Prior to this role, she managed a program that delivered integrated primary care and psychiatric services to individuals experiencing homelessness in community-based sites across New York City. She has a master's degree in social work and a master's degree in public administration from Columbia University. Without further ado, I'm going to turn it over to the next speaker. That will be Connie Sharp.
Thank you, Corey, and good afternoon, everybody. Next slide, please. So the workforce system's purpose is threefold. It is to help job seekers provide access to employment, training, and support to help them keep, gain, and retain jobs. The other purpose is to match businesses with talent and to prioritize underconnected populations by providing services and support to those populations that are underserved. Next slide, please. This is a very high-level overview of what the typical workforce system looks like. This is not one size fits all. There are two associations main associations that support the workforce system. The National Association of Workforce Boards, which is what I represent, serves the workforce boards in the country. And then there's the National Association of Workforce Development Professionals, which support the staff that serve in the America's Job Centers. They also support what we call the frontline staff, or the partners that actually serve the clients. The head, or the federal agency that the workforce system is responsible to, is the Department of Labor. Our money comes down through the states. All states have a state workforce board. Depending on how every state is set up, you may or may not have local workforce boards, which have their own staff. Down to every state has what we call a one-stop or an America's Job Center. Next slide, please. The workforce boards are all mandated by federal law. They are comprised of 51% business majority. They have to have representatives from economic development, higher education, Department of Rehabilitative Services, adult basic education. 20% must be comprised of workforce representatives. Those are typically from labor or unions. And then we have other reps that serve on workforce boards from veteran services, employment and training, housing programs, and then other individuals that are appointed by your chief local elected official. Those could be county commissioners, your board of supervisors, judges. It just depends on your state, or your governor. Next slide, please. This is your structure of a typical America's One Job Center. The only role that is mandated by federal law in a one-stop center is your one-stop operator. That person coordinates all the partners in that one-stop center. There are two partners that are required to be in that one-stop operator. That is the Workforce Investment Act Title I, which is where the boards come in and have oversight. They provide adult dislocated worker and youth services. And I'll get into that in another slide. And then we have what we call Wagner-Pizer Title III Labor Exchange and veterans programs that are administered by state staff. There are 3 states where state staff those merit staff state programs can be provided by Title I program staffs. Those are Massachusetts, Colorado, and Michigan. Those 2 components have to be in every one-stop center or America's Job Center, but there are other partners located in this America's Job Center Veteran services, faith-based and community organizations can be housed in there, adult basic education, migrant farm workers, depending on where you're located, Department of Rehab Services or VOC Rehab, depending on what your state calls it. And then if you have tribal partners, they can be also co-located in your America's Job Center. It all depends on the agreements that your one-stop operator hammers out. Next slide, please. At their core, workforce boards are basically conveners of your community to create a local system that enables the individuals in your community to become self-sufficient and off public assistance, to make sure that your employers have the talent that they need, and to connect those underemployed and unemployed individuals to jobs and careers. The misnomer that we've always loved to say is we're not the unemployment office, because we don't unemploy people. We're the employment service because we'd like people to get jobs. Next slide. We're going to discuss a little bit about some of the services that you can actually find in the America's Job Centers. Next slide, please. So some of those programs that can be offered are overseen directly by the board. These are the adult dislocated worker and youth. These are funded annually by Congress. The adult program offers universal programming, which means any person over the age of 18 can walk into an America's Job Center and get help with writing a resume, job search, that basic core, I need to get a job, what is my first steps? As long as you can prove that you have an ID and a social security card, you can get services. When it comes into this program and you have income eligibility or you are a veteran, you can also get individualized training services. Those can include on-the-job training, which means we place you with an employer, and that employer will put you through a training program while you're working. This also includes registered apprenticeship, which is a priority of the Trump administration. And it can also mean going to college or vocational training. It just depends on what your career path takes you to. This program serves people from ages 18 to 64. Then we have dislocated worker. That program serves people that have lost their jobs or their source of income through no fault of their own. This also includes displaced homemakers, those individuals who have lost their main source of income, but they did not work themselves. Those are typically people who have lost their spouses or their partners, and military spouses. And then we also have a youth program that serves 14 to 24-year-olds. They can be in school or out of school. We do target out of school youth, or what we call disconnected youth. We prioritize work experience because we want to connect those youth to work. And there are elements that are involved that do include things such as counseling, work, getting them job ready, and GED prep. Next slide, please. There are other titles in the Workforce Innovation Opportunity Act. Title II is Adult Education, which partners in the America's Job Center. It provides GE test preparation. We also have, again, Title III, which is Wagner Pizer. It's the employment service. It's the universal service for job seekers. We call that labor exchange. They also provide fidelity bonding, workforce tax credits, rapid response, equal employment opportunity, and then Title IV, which is the Rehabilitation Act, which assists individuals with disabilities. We also have in the areas that have this program, we have what we call CSEP or Title V. It's the Senior Community, I always forget the second S, employment program, but it is for low-income unemployed individuals 55 and older. It's part-time subsidized training that's typically placed in communities. You'll find a lot of these older workers in libraries and different community agencies. It's to keep them engaged and working. Next slide, please. These are other services that you will typically find in a America's Job Center: reemployment services, career and technical education, community service block grants, HUD, which is housing, Job Corps, migrant farm workers that serve basically the farm workers programs, health and human services programs such as child care and temporary assistance for needy families, youth build, and in extremely rare cases, you will find a unemployment compensation rep that can look things up for you, not necessarily help you with your unemployment claim. Next slide, please. If you are really interested and want to find out where your local board is, or you want to visit your local America's Job Center and you have no clue where it is, please visit careeronestop.org. This website gets updated about every 6 months and has the location of every America's Job Center and Workforce Board in the United States and our territories. Any questions for me?
Well,
Thank you.
Connie, I have a question for you. Is there a fee for using a service in American Job Centers?
No, sir. They are all free.
Okay. And
There's a cost to use an America's Job Center.
can anyone use American Job Center besides when they for this program, like those programs that you were mentioning? Any employer?
Any employer can use the America's Job Center. Any person can walk into an America's Job Center and get services as long as they are an American citizen. And I have to say that because they are funded with federal dollars.
Okay. And my last question will be is that if one of the crisis centers wanted to utilize the services for as an employer to bring on some crisis staff members, can they utilize their service to help them with any of help them develop like and hire individuals for their centers?
Absolutely. You definitely can talk with a job specialist that can list a job posting. We can help you vet individuals and see who we may have in training and a training program that might be suitable. We can also look and see who's seeking work, especially if you're looking for people in Washington, D.C., Arlington, Virginia, where there have been mass federal layoffs. A lot of those individuals have actually been going to the local America's Job Centers there and getting services. So there's a lot of exchange going on of information, trying to get those people re-employed in lucrative careers. Because what we do is help people find jobs or get retrained for jobs of the future.
Thank you. Any other questions?
I see some Q&A questions here.
Yeah, you kind of touched on this already with Cora's question, but I didn't know if you wanted to add anything else to what would be the most appropriate way to utilize an AJC as a 988 center to address workforce shortages.
I would contact your AJC and talk to the program manager there and see if you may have an adult or a dislocated worker that is either in training. You may have a youth. It depends on what kind of work experience can you offer that individual. You may have somebody like a youth that's over 18 that you can develop a work experience for to get them some practical work experience, maybe answering the phones or as a receptionist, or as data entry. I hesitate to put a work experience into a situation where they're handling very sensitive information. But there are options where you can do a on-job training where the workforce system can pay for part of that training cost of that new employee.
Okay, and that actually I think is maybe a good segue into the next question from Nicholas.
Mm-hmm.
Nicholas, if I see that you've got a couple of questions here,
You,
so if you'd like
yeah.
to raise your hand and come off mute and ask, we encourage that. But his first question here about on-the-job training, how can we, as this clinic that he's referring to,
Mm-hmm.
receive or access reimbursements?
Nicholas, you need to talk to Tracy Marquez at Pikes Peak Workforce Board. And tell her that I sent you. Also, my CEO lives in Pikes Peak. He actually lives in Colorado Springs. So I know Tracy quite well. So give her a call and mention that you are interested in developing an OJT at the clinic there. She'll be delighted to assist you. Trust me. In fact, let me write your name down and I'll let her know to look for your call.
Okay, and would she also be able to assist with apprenticeship ship model and his
Yeah.
other questions? Okay, perfect.
Yeah. She's the board director at Colorado Springs.
Okay.
And honestly, I know that they're working. I don't know if you can do an apprenticeship for med assistants just because it's so short term. You may want to do an OJT model for that. But behavioral health tech might be a good registered apprenticeship model. I would say let's have you have the conversation with Tracy and let's see where it goes because there's a lot of options right now for work-based training.
Okay. I think that at this time, thank you, Connie and Nicholas. Connie is definitely giving you a good contact. She's also can chat more with you online while we're
Definitely.
going through the presentation. You can definitely chat with her on the next one. We're going to move to the next presenter. dinner, but we also will have time at the end to answer more questions if there are more questions that we didn't get a chance to answer during this session. So we're moving on to the next speaker, which will be Tamara Barbie.
Thank you, Corey. Hi, everyone. Good afternoon. I will be covering the Area Health Education Centers program. Next slide. I will go over I will cover the overview of the AHAC program and activities, dive into a little bit about the community health workers and how we work with them, and how our program is working with behavioral health. And then I'll have time for questions afterwards. Next slide. Go ahead, you good, next slide. So the purpose of the AHEC program is to develop and enhance education and training networks within communities, academic institutions, and community-based organizations. In turn, these networks support the supply, distribution, and retention of health workers, enhance healthcare quality, and improve healthcare and delivery to rural and underserved populations and areas. Next slide. The AHEC program was established in 1971, and we currently have 49 AHEC programs across the country. 46 of those are schools of medicine, and 3 are schools of nursing. Within these programs, there are 268 regional centers. Our project period is 5 years, and we are currently in the 4th year of that project period. AHECs also respond to healthcare needs and gaps in their region. In academic year 2024, we have trained over 370,000 students and healthcare professionals in primary care settings, rural areas, and medically underserved communities. Next slide. The AHEC model is a hub and spoke, with the School of Medicine or Nursing being the program office and the central hub for oversight and subject matter expertise. The program office is a HRSA grantee in a subcontract with the regional centers in their states. This model allows for better coordination and communication with the program office and centers, more accountability and guidance from the program offices through statewide evaluation and AHEC Scholars curriculum development. AHEC Scholars, healthcare providers, and specialized training in community-based rural and underserved settings. So our centers are the ones who implement the program requirements, but they work with the program offices to help keep everything aligned with the notice of funding opportunity. And we have a couple of main areas, which is they have to cover community-based training, strategic partnerships, work with rural and underserved areas and populations, practice transformation in the curriculum should be interprofessional in education and training. Next slide. A big component of our AHEC is their ability to bring community organizations together and address health workforce issues and other statewide health initiatives. They establish strategic partnerships. The AHEC regional centers work closely with the following organizations: primary care associations, local workforce boards, rural health associations, nonprofits, state and community organizations, clinics and hospitals, academic institutions, and school systems, and some more that we have not covered. These partners help to ensure the relevancy, coordination, and timelessness of the education and training provided to students and practicing healthcare professionals. An important component of the program is mental health that we like to highlight, the mental health and well-being of our students that are participating in the program and of practicing healthcare professionals. And we can see how this aligns with the 988 team and become a great partner with our various centers and AHEC program offices. Next slide. So I'm going to cover a little bit about the AHAC activities. Next slide. So this slide is covering the various activities that occur within AHAC program, targeting the entire educational pathway from high school students through practicing healthcare professionals. For all activities, they must touch on the following core topic areas. Training within interdisciplinary health care team is strongly emphasized in AHAC. High school students are exposed to healthcare careers through a variety of activities in the health career field. For example, many AHECs have a robust Project ECHO program, which is the extension for community health care outcomes, which is an evidence-based model that connects primary care providers in rural areas to university faculty and other specialists for monitoring for mentoring regarding complex medical issues or cases. The interprofessional aspect supports them with quality care in the community. So our program is really big on interdisciplinary training, where the students are able to work with different fields and careers. So we'll have like a medical student in social work and physician students get together and really have some dialect based on the curriculum to kind of see the differences in how they work together in the real world. Next slide. Another component of the AHEC is the AHEC Scholars Program. AHEC Scholars is structured by cohorts with students from different backgrounds and degree programs, and they must participate for at least 2 years. It's a longitudinal interdisciplinary program curricula that implements a defined set of clinical, didactic, and community-based training targeting students enrolled in health profession degree programs and allied health workforce programs. The scholars curriculum supplements the student's degree program curriculum and specializes training activities in rural and underserved areas. Students develop an awareness of the barriers in healthcare delivery and have a better understanding of communities' unique complex needs. AHEC grantees are required to track their employment after graduation. This helps us to see if those students who participated in the program are working in a rural and underserved areas so that they can then implement what they learned throughout the program. Next slide. This right here on the slide is a list of the different disciplines that we work with and that work together to help learn how their fields work together when they start working. Next slide. Another requirement of the Scholars Program is clinical training in the community. AHECs also support clinical trainings for other students, exposing them to opportunities away from the academic center and in rural and medically underserved areas. In academic year 2025, community-based training occurred over 3,400 medical and medically underserved community sites in over 2,000 rural sites and over 2,600 primary care sites, including community clinics, FQHCs and lookalikes, community-based support programs, hospitals, and behavioral health facilities. Next slide. I'm going to go over a little bit in how we work with community health workers in various aspects of our program. Next slide. So AHEC strongly supports CHWs due to their strong public health focus and close connections to the community they serve. They provide social support and build a trusting relationship with their patients and ensure the community is continuing to receive the care and resources that they need. They lead or support their state CHW programs, certification programs, and help them meet any requirements that are necessary. We do have a couple of our programs that have actually worked with the state to create a statewide certification. Because the CHW programs varies within regions, organizations, we help them along the way so that they can also get the training and that the health professions and health profession students can really see how beneficial CHWs are in the community. Next slide. So we have a couple of CHW trainings that we would like to highlight that we think have been really at the forefront of CHWs. So the first is at Texas, where they have Primadoras of South Texas, and they created a full curriculum to meet the requirements. And CHWs, our Primadoras, go in to provide services and support to members within the South Texas colonias, along with the U.S. border, Mexico border. Over 1,800 colonias exist in Texas, and these areas lack basic infrastructure, with some not having roads. So the Primadoras or the CHWs really help connect them with services that they need. The second is Pennsylvania AHAC. They created a statewide 12-month program where they get their didactic and hands-on training job hours with our AHAC centers. They also help pay with pay increases for their skill set. So they are trying to get CHWs to be reimbursable with CMS. Third is Montana, who has a Pathways of Messengers training program. This involves culturally competent curricula that has been customized with information on tribes in Montana. As messengers, the CHWs are actively involved in the community and will be sought out for support and advice. Next slide. I'm going to talk a little bit about the behavioral health aspect of the AHEC program. Next slide. So AHEC support many behavioral health students, clinical social workers, psychologists, and health professions. In academic year 2024 to 2025, 441 behavioral health students were part of the AHEC Scholars Program, and over 10,300 behavioral health providers receive continuing education in various courses, such as behavioral health integration into primary care, substance use disorder, and clinical communication skills, and more. Next slide. Many AHECs have numerous behavioral health continuing education for providers in CHWs with specific topic specifics in the areas of communities. One example is Nevada, who has offered CE with a list of behavioral health training topics that has been very useful for them in the field. Next slide. As mentioned previously, we do have continuing education as a focus of the AHEC program, and provided resiliency is often highlighted. Training identifies the signs of burnout and provides tools and strategies to mitigate burnout, such as stress management, self-care, and self-care techniques. Resiliency training is holistic and offers skills and strategies to bounce back from stress and burnout. These trainings are all also beneficial to 988 staff as well. Next slide. Here go my contact information if you have any additional questions, and now I would like to open it up for any questions.
Are there any questions? I'm looking in the Q&A. I don't see anyone, but I have a quick question. So, how do programs like crisis centers learn more about AHEC that are offering those like CHW trainings in their state?
Yeah, so most of our AHECs have a detailed website with up-to-date contact information. So if you like to contact your state, you can email our program mailbox at ahecprogram@hrsa.gov and we can connect you. Also, you can Google for your state AHEC, and all of our programs have a state website, and even some of the centers have websites as well for you to connect with them.
Let's see if there are any other questions. No questions. Another question is, what type of training opportunities, in particular in behavior health, and possibly some crisis training that AHEC may be offered in that they can get through their AHEC program?
So, in addition to what was included in slide 18 and 19, each or each region may have different opportunities for behavioral health students. So, of course, the main is that AHEC Scholars Program where they are able to train, and there is that didactic part of the program that helps them to get a little bit better understanding of the communities that they serve, as well as there's a clinical component where the students will be able to go out and get the hands-on experience in the field. Um, the ECHO program as well, and some of our programs have unique structures when it comes to and programs that work with behavioral health. So I would suggest you reach out to them and they can give you a little bit more information on how they can help with the behavioral health professionals.
Okay, thank you. Well, thank you for, I don't see it, or maybe it was another question. It said, okay, Nicholas has a question. And how can a private clinical site become a designated host for AHEC scholars or other pipeline programs specifically for behavioral health tech and paraprofessional rotations?
Oh, thank you. That's a good question, Nicholas. I would suggest you reach out to the AHEC program office in your state, and they will help to see how you can become a partner with them and possibly a host site in the future or even now. That would be the best option. So if you would like, you can email us at ahecprograms@hrsa.gov, or you can Google your local, and I want to say you were in Colorado. So we do have an AHEC program office in Colorado, and you can reach out to the program office directly as well.
Thank you, Tamara. If you can drop some of the contact information so an individual will have it in the chat, that would be great. We're
Sure will.
going
Thank
to
you.
we're going to move on to the next speakers. I think Isabel is going first.
Thank you. Hello, everyone. So, my name is Isabel Gorgoroso, and I am joined by my colleague, Ms. Carrie Dorn. We are the team leads for the Behavioral Health Workforce Development Programs here in HRSA's Bureau of Health Workforce. Next slide, please. So quickly, a little bit about HRSA's Bureau of Health Workforce. BHW's mission is to improve the health workforce, to improve the health of underserved populations by one, strengthening the health workforce, and two, connecting skilled professionals to communities in need. And BHW's health workforce programs incorporate at least one aspect along this continuum. So examples may be providing education or continuing education on evidence-based practices, providing on-site clinical training in community-based settings, or fulfilling a service commitment in a medically underserved community and rural area. Next slide, please. So HRSA's workforce programs have 4 aims. One, it's to increase access, making it easier for people to get the type of healthcare they need. 2, to balance the supply with the demand for care by expanding the number of health professionals. 3, to improve workforce distribution by encouraging training and working in underserved areas. And then 4, improving the quality of the workforce and the care provided to enhance patient care, improve patient safety, and advance health outcomes. Next slide, please. So now Carrie and I are going to talk about 4 programs. I'm going to start with the first one, and then Carrie will talk about 3 others that sit in our division. And I'll start with the Behavioral Health Workforce Education and Training Program for Professionals, which is a mouthful, so we like to call it BWET Pro for short. BWET Pro's goal is to increase the supply of behavioral health workforce, to provide integrated behavioral health care who are committed to work in high need and high demand areas. So this is a training and education grant that started July 1, 2025. It's a 4-year program, so it'll end June 30th, 2029. So last year we made 105 awards. And these 105 grantees have 4 overall objectives. They are going to increase partnerships with training sites in high need and high demand areas, promote training models to integrate behavioral health services into primary care settings, recruit a behavioral health workforce interested in working with children and adolescents and young adults, and recruit and expand the capacity of clinical supervisors to mentor and support behavioral health trainees. Next slide, please. Okay, so this is a little bit more about our cohort, the BWET Pro cohort for this 4-year program. This is essentially a heat map of where our grantees are located. So I think in the number 1 spot is California. We have 12 BWET Pro grantees there, and I think number 2 spot is New York. You can see we're not in all of the states, but we are in all of the HHS regions. And grantees are usually accredited institutions of higher education or accredited professional training programs. So they're typically public and private institutions of higher education or nonprofits, hospitals, HRSA funded health centers, FQHCs or federally qualified health centers, and others. And so these grantees focus on training a variety of disciplines that are listed here. The eligible disciplines range from psychiatry to psychology, social work, counseling, occupational therapy, and they are trained at the master's, the doctoral, and the postdoctoral level. Next slide, please. And so these are just a few examples of some of the partnerships that our grantees have made in the community to enhance the experiential training for our BWET Pro trainees. There's a requirement within their grant to partner with community sites and to use these experiential rotations and expose these trainees to underserved populations to build competencies that align with real world needs and increase the likelihood that trainees will practice in these areas after graduation. And so this program equips those joining the workforce with skills and competencies needed to sustain care delivery in these communities. And then another requirement that these grantees have is to have a mechanism to support job placement after graduation. So we do get a lot of positive feedback from grantees that these sites that the grantees have partnered with have actually hired trainees upon graduation. And now I'm going to hand it over to Carrie Dorn.
Great. Thank you, Isabel. Now I will present on our paraprofessional programs, and the first is the Behavioral Health Workforce Education and Training Program for Paraprofessionals, also a long name that we call BWET Para. And the overarching goal of this program is to increase the number of behavioral health paraprofessionals by expanding community-based experiential training. This program was reawarded in September 2025 and goes for 4 years through August of 2029. We have 25 grantees across the country and they represent 18 states. And key components of this program include providing a paraprofessional certificate training program, enhancing relationships with community-based partners, improving access to quality behavioral health services in high need and high demand areas, promoting collaborative training through integrated team-based models of care, and also recruiting a workforce that's interested in working with children, adolescents, and young adults. Next slide, please. Our next program is the Opioid Impacted Family Support Program. And the goal of this program is also to increase the number of peer support specialists and other behavioral health paraprofessionals. This program does have a special focus on serving families impacted by opioid use disorder and substance use disorders, as well as children and adolescents who have experienced trauma and might be at risk to develop mental health conditions. This program was reawarded in September 2024 and goes for 4 years through August 2028. And we currently have 31 grantees and they represent 24 states. And key components of this program are providing a paraprofessional training program with both didactic and experiential training, leveraging partnerships with community-based and non-traditional partners that serve high need and high demand areas, and establishing a level 2 program that provides on-the-job training through a registered apprenticeships. Next slide, please. So this slide has examples of the paraprofessional certificates that are offered through our programs. And as you can see, our awardees are implementing a wide range of paraprofessional training programs. We have peer support specialists and community health workers, which are the most common programs, but there is variation across the country, and that's influenced by the state-approved certificate programs. And within these programs, grantees really have the flexibility to implement the program that best fits the needs of their community and will best address the workforce gaps that they see in their regions and states. Next slide, please. And this slide lists the types of settings where our trainees are placed. So for the experiential training component, trainees are embedded within teams and community-based settings in high need and high demand areas, such as outpatient mental health centers, judicial services, and settings that serve children and families. Next slide. So both of these paraprofessional programs have a level 1 program that is a pre-service training. And through this level 1, there's didactic and experiential learning, and then the individual receives their certificate in a paraprofessional discipline. The level 2 includes the on-the-job training through the registered apprenticeship model, and participants earn a salary while they're enhancing their skills in a practice setting. And the registered apprenticeships that we have can either be approved by the state or the Department of Labor, and our grantees have up to 1 year to establish their apprenticeship program. The level 2 is an optional track within our BWET Para program, and it's a requirement for the Opioid Impacted Family Support Program. And the aim is to transition trainees from level 1 to level 2, and also to increase the capacity of the apprenticeship over time within the program. HRSA does provide support to those in apprenticeships for up to 4 years, and HRSA provides stipends and also covers related training costs. Next slide, please. Now I will share about one additional professional program that we have, the Integrated Substance Use Disorder Training Program that we call ISTP. And this program is actually a demonstration project, and it was created in order to help address the opioid epidemic in the United States. This program engages members of the interdisciplinary team, and its purpose is to increase expertise in treating opioid and substance use disorders across the care continuum, so from prevention and treatment through recovery. Key components of this program include didactic training and interprofessional clinical practice in mental health, substance use disorders, and opioid use disorder services. And for the prescribing providers that do participate in this program, training and competency in medications for opioid use disorders is an essential component. This program has 3 cohorts, and the period of performance is 5 years. So the first group of grantees started in 2021, and they will be ending this June. We had a next group added in 2022, and they will be ending next June in 2027. And our largest cohort started in 2023. It now has 19 grantees, and this group will be continuing until June of 2028. Next slide, please. Here is the list of eligible disciplines that participate in ISTP. The program began with the first 4 disciplines, and then counselors and nurses were added in the Notice of Funding opportunity in 2023. And this program engages fully licensed providers as well as provisionally licensed providers. So that includes individuals who have completed graduate education and are still working toward their clinical training requirement under supervision, such as social workers and counselors. Next slide, please. This slide lists examples of clinical training settings that host ISTP participants. So we have many outpatient settings, including primary care and ambulatory clinics, and settings that focus on underserved communities like FQHCs and rural health clinics. There are also some academic and teaching health centers and large hospitals where both the didactic and the experiential training takes place within the hospital system. The IST program has a lot of flexibility, so grantees have developed training models that are really tailored to their settings, disciplines, and populations served. Some of the innovative approaches that we have include supervision for clinical hours for licensure, a collaboration through interprofessional team-based models of care, and some very unique training experiences, such as community outreach through mobile vans, ballot groups where providers process challenging patient interactions together, and simulations where trainees interact with actors and deliver care in a simulated environment. And that was my last slide. So now we welcome any questions you have. And here is our contact information. Please feel free to contact Isabel or to contact me with any questions about HRSA's behavioral health workforce programs.
Thank you, Isabel and Carrie. We have a few questions for you. The first one I'll read for you. It says, "Can you provide a link to list of state/partners for the BWEP Para program?"
Yes, thank you for that question. I will put a link in the chat. It is HRSA Find Grants. So at that website, you are able to search for our programs either by the program name, by the state, by the year. There are a lot of ways that you can search for the programs, and all of our current and past grantees are listed there. Great, and Isabel put that in the chat. Thank you.
Okay. And the next question that this comes from Nicholas. How can a community-based clinic like ours find a list of current BWEP paraprofessional grantees, which is similar to the other question you have, in our region so we can offer our clinic as a field placement site? for their trainees. So they want to become a field placement site. And so wondering how to touch bases to become one of the field placement sites for their clinic.
Yes, that's wonderful. Yes, we encourage you to look at the current list of grantees. And if there are programs in your area and region, we encourage you to reach out, and they are always looking to expand their experiential training sites. And so that would be great to connect.
Nicholas also had a question that says, was the notice of funding opportunity or a grant map to mention in your presentation? Meaning that I'm assuming that the next time, I guess it's going to be coming available for, I guess, or you can probably answer this question. What are the eligible entities that can apply for the grant for your NOFOs that offer these programs like the BWEP paraprofession and some of the programs that you offer?
Yeah, so I'll just say that right now we don't have any open notices of funding opportunities. So all of our programs were reawarded recently. So they will be coming probably in 2028 and 2029. But now is a great time to prepare. So as Isabel mentioned, many of our grantees are with universities. We have community colleges. We also have community health centers, FQHCs. And other types of community-based organizations that are grantees in all of our programs.
Thank you. And I think that the last question I have on this list is, what have been some challenges with training at rural health clinic? Has it been difficult to attract people to those sites?
Let's see. Isabel, do you have any thoughts about that one?
I can say that we have heard from grantees just, recruiting trainees to do their experiential training in rural sites in general can be challenging, particularly if you're going through the program and you have a family and you can't make the commute out there, but the grant does allow for a lot of support. So I have seen them offer a lot of support for the trainee to, be able to commute out there, to be able to I've even seen provide temporary housing to help support them so that they can get the full experience and get the training while they are getting their experiential training out in a rural community. So we have heard that it can be challenging, but we do have really creative grantees. And so they are consistently thinking of new and innovative ways to be able to attract more trainees to get into these, hard to reach and rural or remote areas.
Thank you. I don't see any more questions, so we will roll into the additional question session where individuals can ask questions to any of the presenters. At this point, any of the presenters that, whether it's Connie or whether it's Tamara, whether it's Isabel or Carrie, feel free to drop any question in the chat for any of the presenters at this time.